greatest gain for the NHS in integrating both patient-generated data with medical and clinician-generated data is that sense of partnership and real involvement in healthcare for both the professional and the individual patient, because it's only by that coming together and that shared approach that we will get actually the best possible outcomes for everyone.
So the programme is enabling better information flows across many different aspects of the health and social care services by utilising information that we get from the general practitioner, information from school nurses, from health visitors, and through our child health information systems. We're then able to start thinking about how we can share that information. So we share some basic demographic information with our local authorities. We want to increase that so that they can use that to help their children book for their 2-year nursery places, and also through eRedbook we're now able to start sharing immunisation data to parents, and we want to expand that through to their 2-year integrated health check, their screening information. So it sort of is a precursor to wider systems sharing of information.
Digitising children's health information is particularly important because child health information exists all over the health and care ecosystem in many different organisations and in many different systems. Now, the key events in that child's life aren't necessarily brought together into a useful summary that can be used to treat the child appropriately. And this isn't well known. When we asked parents, 76% of parents thought this was already happening. So essentially, we need to digitise children's health records to make the information move, to do it to where it can do most good to help the children.
So the real world of patients is they go from their homes to a GP surgery, to a community nurse, to a mental health nurse, to a hospital, and they don't see those organisational boundaries in the care that gets delivered to them. And it's important that we have an information system that ignores those boundaries and creates a joined up view, so that we understand the joined up costs of that care pathway and the joined up outcomes of that care pathway. And in that way, we're able to kind of understand the interdependencies of our services. We're able to understand where resources can be best pointed to get the best outcomes that we possibly can.
In terms of where will investment come from, in my view, most of it's got to come from the money that we've already got. So it's about doing things in a different way, using the technology to release funds from one place to move them to another, which isn't easy because it means you've got to keep business as usual running whilst you're implementing change. There is some national funding, but that's only about, if we look at the 5-year period that we're talking about, 2015 to 2020, we know that there's 4.2 billion of central funding around technology, which is rough back of the envelope, probably about 20% of really what the NHS spends overall on technology. So it's, it is something, but again, a lot of that's already allocated, and only a small proportion of that is really for new things. I think it's back to really driving change and transformation to deliver and release funding from one place to move it to the other, which is going to take strong leadership and strong application of those planning frameworks.
Well, what's most inspired me about today's event are the stories from the speakers we had today, how the work they're doing to innovate and to get new models of care, to get personal health records really working for citizens, for patients, for carers. It's a powerful technology that has got the potential to transform health and care.